Okay, so today we're diving into a topic that's, well, it's pretty crucial for a lot of guys out there. We're talking about prostate cancer.
Yeah, it's a big one. And honestly, it's something that touches a lot of men. We're talking 1 in 7 globally, which makes it the second most common cancer in men worldwide.
Those stats are definitely attention grabbing. But before anyone starts panicking, there is some really good news here.
Absolutely. Prostate cancer, especially if we catch it early and get the right treatment going, is very often curable. So that's something to hold on to right from the start.
That's a huge point, and that's actually what we really want to dig into today. We've been poring over some in-depth information from the Mayo Clinic, and our mission in this deep dive is to break down the most important stuff for you.
Exactly.
We want to give you a clear, no-nonsense picture of what prostate cancer is, who's most at risk, what kind of symptoms to look out for, how doctors go about diagnosing it, and then all the treatment options that are out there.
All right, because it can get a little overwhelming. There's so much information out there, and it can be hard to filter through it all.
For sure. So, let's start with the basics. What exactly is the prostate? And what happens when cancer starts developing in there?
Okay, so the prostate, it's this small gland, but it's got a really important job.
Small but mighty, right.
Yeah, exactly. It sits right under the bladder, and it wraps around the urethra, which is the tube that carries urine out.
Okay.
The prostate's main gig is to produce fluid that helps nourish and transport sperm. We call that seminal fluid.
Got it. So, how does cancer actually develop in the prostate? It's like those cells just go haywire, right?
Pretty much. It starts with changes, mutations in the DNA of the cells.
Ah, those sneaky mutations, always causing trouble.
Well, sometimes.
Hmm.
And in this case, those changes can make cells behave differently. Instead of growing and dividing normally, they start multiplying way too fast and they don't die off like they should.
So they just keep building up.
Yep, they keep piling up and they can form a tumor in the prostate. As this tumor grows, it can push on the tissues around it and even start to invade them.
And that doesn't sound good.
And another big concern is that those cancerous cells can break off from the tumor and travel to other parts of the body. That's when it spreads, and that's what we call metastasis.
That makes sense. And the Mayo Clinic had this really helpful illustration comparing a healthy prostate to one with cancer. The difference is pretty striking.
Oh yeah, I saw that.
The one with cancer is all enlarged and kind of lumpy.
It really shows you how the normal structure gets completely distorted.
Absolutely. So let's talk about who's more likely to get prostate cancer. What are some of the risk factors that doctors look at?
Well, the biggest one is age. The older a man gets, the higher the risk. Most cases are diagnosed after 50.
So that's why regular screenings become so important as men get older.
Exactly. Early detection is key.
Makes sense. What else plays a role?
Well, race and ethnicity seem to matter too. For example, in the U.S., black men have a higher risk of prostate cancer than men of other races and ethnicities. And unfortunately, the cancer tends to be more aggressive in black men, and it's often found at a later stage.
Wow, that's really important to know. Are there lifestyle factors that can increase the risk?
Weight seems to be linked. Studies suggest that being obese might increase the risk and potentially make the cancer grow faster and come back after treatment.
So maintaining a healthy weight is a good strategy all around.
Absolutely. Then there's genetics. Having a family history of prostate cancer, particularly a father or brother, definitely bumps up the risk. And even a family history of certain breast cancers, especially those tied to BRCA1 and BRCA2 gene mutations, can increase the risk of prostate cancer too.
So it's not just immediate family, but kind of a wider family pattern that might be important to be aware of.
Right.
Okay, how
Right.
about smoking?
That's an interesting one. The research is a bit mixed, but there's some evidence that smoking could raise the risk of the cancer coming back and spreading after treatment.
So another good reason to quit.
Definitely.
All right, let's shift gears and talk about symptoms. What are the signs that someone might have prostate cancer?
This is where things get tricky. Early prostate cancer often doesn't have any noticeable symptoms.
So no warning signs in the early stages when it's most treatable.
That's the tough part. That's why regular screenings are so important. But when symptoms do show up, it often means the cancer has advanced.
Okay, so if someone does start experiencing symptoms, what should they be on the lookout for? Let's start with the early stage.
All right, so some early signs could be changes in how you pee. You might have to go more often, especially at night, or you might have trouble starting the flow or have a weaker stream.
Those are all things that guys should definitely pay attention to.
Yeah, and you might see blood in your urine. It could look pinkish, red, or even kind of brownish like cola. Or you might see blood in your semen.
Okay, and what about if the cancer has progressed? Would the symptoms be different?
Yeah, as the cancer advances, it can cause a wider range of problems. You might have accidental leaks of urine or persistent back pain, especially in the lower back.
And that's from the cancer pressing on the spine, right?
Right. You might also get bone pain in other areas, like the hips or legs.
Oof, that sounds rough.
And some men might experience erectile dysfunction or problems getting or keeping an erection.
Right.
You might also feel unusually tired or have unexplained weight loss.
So these later symptoms are kind of more general.
Yeah, some of them can be, but they can also be signs that the cancer has spread.
It's really important to say here that anyone who notices any of these symptoms, even the earlier ones, should get checked out by a doctor right away.
Absolutely. Early detection can make a world of difference.
Okay, so if someone has symptoms or falls into one of those high-risk groups, how do doctors diagnose prostate cancer? What kind of tests are involved?
Usually it starts with a couple of basic tests.
Like what?
The first one is called a digital rectal exam, or DRE. Basically, the doctor inserts a gloved, lubricated finger into the rectum to feel the prostate. It's a way to check for any lumps, hard spots, or changes in size or shape.
Okay, so it's a way to actually feel the prostate gland.
Exactly. And they usually do a blood test too, the PSA test.
Right, I've heard of that one.
Yeah, that stands for prostate-specific antigen. It measures the level of PSA in the blood. PSA is a protein made by both normal and cancerous prostate cells, so high levels can be a red flag.
So those initial tests kind of act like a first alert system.
Right. They can give us clues, but they don't give the full picture.
What happens if the DRE or the PSA test shows something suspicious?
If those tests raise concerns, the next step is usually a biopsy. That's where they take tiny samples of tissue from the prostate and look at them under a microscope. If they find cancer cells, they can also tell how aggressive the cancer is likely to be.
And how do they determine that?
They use something called a Gleason score. It's based on how abnormal the cancer cells look compared to normal ones. The higher the score, the more aggressive the cancer is likely to be.
So that score helps doctors figure out the best treatment plan.
Exactly. And they may also use imaging tests to see if the cancer has spread beyond the prostate.
What kind of imaging tests?
There's a few they might use. A bone scan can show if the cancer has reached the bones. A CT scan gives detailed images of the body and can show if it's spread to nearby lymph nodes or organs.
I see.
And an MRI can create super detailed images of the tissues in and around the prostate. Sometimes they might use a PE scan too, which can highlight areas where cells are unusually active, which could be a sign of cancer.
So it's a whole arsenal of tools to really understand what's going on.
Exactly. They want to get as much information as possible to make the best treatment decisions.
Okay, let's talk about treatment. What are the options for prostate cancer?
Well, treatment depends on a lot of factors, like the stage of the cancer, the Gleason score, the man's age and overall health, and even his personal preferences.
Right, so it's not one size fits all.
Not at all.
Yeah.
But one thing to remember is that treatment is generally most effective when the cancer is caught early before it's had a chance to spread.
Makes sense.
And sometimes, especially for slow-growing, low-risk cancers, doctors might recommend active surveillance.
What's that?
It basically means monitoring the cancer closely with regular PSA tests, DREs, and maybe repeat biopsies to see if it starts changing or growing more quickly.
So it's like a watch and wait approach.
Exactly. It's not always about immediate treatment. But for localized cancer that does need treatment, there are a couple of main options.
What are they?
One is surgery to remove the entire prostate gland. That's called a radical prostatectomy.
And the other?
The other is radiation therapy that uses high-energy beams to kill the cancer cells.
So those are the two main approaches for localized cancer. Are there other options too?
Yeah, there are, especially for more advanced cases. There's chemotherapy, which uses drugs to kill cancer cells throughout the body.
Okay.
There's cryotherapy, which uses extreme cold to freeze and destroy the cancer cells. And there's high-intensity focused ultrasound, or HIFU, which uses focused sound waves to generate heat and basically cook the cancer cells.
Wow, that's pretty amazing technology.
It is. And then there's androgen deprivation therapy, or ADT. This one works by lowering the levels of male hormones, especially testosterone.
How does that help?
Testosterone can fuel the growth of prostate cancer, so lowering it can slow the cancer down or even shrink it temporarily.
Interesting.
But ADT usually isn't a cure on its own. Sometimes they use it along with other treatments, like radiation, to make them more effective.
It's a lot of different tools in the toolbox.
Right. And it's really important to remember that all these treatments have potential side effects, and their success rates can vary. So the best treatment plan for one man might not be the best for another. It's a very personal decision.
That's why it's so important to have open and honest conversations with your doctor and your family.
Absolutely. You need to weigh all the pros and cons and make the choice that's right for you. And there are support groups out there that can be incredibly helpful for men and their families going through this.
Right, because a cancer diagnosis can be really tough emotionally and mentally, as well as physically.
Definitely.
Okay, let's talk about prevention. Is there anything men can do to lower their risk of prostate cancer?
Well, there's no guaranteed way to prevent it, but there are things that can help. A healthy diet is a good place to start.
Like what kind of diet?
Focus on lots of fruits, vegetables, whole grains, and try to limit animal fats.
So the usual healthy eating advice.
Pretty much. But some specific foods have been linked to a lower risk in some studies, like tomatoes, broccoli, cauliflower, and soy products.
Interesting.
But keep in mind, no single food is a magic bullet. It's about the overall dietary pattern. And regular exercise is important too. Aim for something most days of the week.
Right. That's good for overall health anyway.
Exactly. And if you smoke, quitting is a huge one. It can lower the risk of a lot of health problems, including prostate cancer.
Absolutely.
And there are some medications that can help lower the risk for certain men, like finasteride and dutasteride.
Those are the ones for an enlarged prostate, right?
Yeah, that's their main use. But they've also been shown to reduce the risk of prostate cancer in some men, particularly those at higher risk. But it's really important to talk to your doctor about the potential benefits and risks of those medications.
Because they can have side effects, right?
Right, and there's some concern that if you do develop cancer while on those meds, it might be a more aggressive type.
So definitely a conversation to have with the doctor. Okay, before we wrap up, what are some of the potential complications that can happen with prostate cancer, either from the cancer itself or the treatment?
One of the biggest concerns is that the cancer can spread or metastasize to other parts of the body, like the bones. And both the cancer and the treatment can sometimes lead to problems like incontinence.
Which is leaking urine, right?
Right. And erectile dysfunction, which is trouble getting or keeping an erection.
Those can be really difficult side effects to deal with.
They can be. And that's why early detection and getting the right treatment is so important.
Absolutely. Well, we've covered a lot of ground today. We've talked about what prostate cancer is, the risk factors, the tricky fact that early stages often don't have symptoms, how it's diagnosed, the different treatment options, ways to potentially lower your risk, and some of the potential complications.
It's a lot to take in, for sure.
It is. And I think one of the biggest takeaways here is that because early prostate cancer is often silent, men really need to be proactive about their health.
I agree.
Understanding your individual risk factors, talking to your doctor about screening, those things can make a huge difference. The Mayo Clinic has some great resources, and there's a lot of information available online, too.
Definitely. And remember, there are whole teams of medical professionals who are dedicated to helping men with prostate cancer. You don't have to go through this alone.
That's a really important message. So for all the guys listening out there, take care of yourselves, be informed, and don't hesitate to reach out for help if you need it.
Couldn't have said it better myself.
And with that, we'll wrap up this deep dive. Thanks for joining us.